Hello, and welcome to the presentation titled Referral Programs to Reduce Your Patient's Risk for Chronic Disease. My name is Jessica Downs. I'm a nurse consultant with the section of chronic disease prevention in the Department of Health, and I'm here as a member of the Alaska Take Heart and Diabetes Coalition. And I'm here to talk to you today about the low or no cost chronic disease prevention programs endorsed by the coalition and by the state of Alaska. These evidence-based programs are proven to create lasting results in your patients and communities. And thanks to a grant from the CDC, these programs are available at no cost, completely free for your patient. This is an abbreviated presentation, the goal of which is to discuss a program aimed at helping you, the provider, to empower your patient to achieve wellness and prevent chronic disease. This presentation specifically will look at assisting providers to empower patients with hypertension. See the full presentation for additional resources and tools to help your patients with prediabetes, with obesity, with type 1 or type 2 diabetes. To address the blood pressure crisis in America, the American Medical Association, the American Heart Association, and the American College of Cardiology, as well as several other medical organizations, have all backed SMBP as medical best practice. Hypertension has been shown to be well controlled with the self-measured blood pressure program. And why do they work? Because they're built off of a foundation of what we know to work. Collaborative relationships with a lifestyle coach aimed at gradual weight loss, calorie reduction, and increased physical activity. It's not new science, and it has been shown to be the most successful intervention across multiple disease states. We call these programs lifestyle change programs. The self-measured blood pressure program, or SMBP, is another one of these coach-led chronic disease prevention programs. The program focuses on teaching participants about blood pressure and how their diet, lifestyle, stresses, and similar factors all impact blood pressure. The programs vary in length, but they average around 4 months. Participants are taught how to check their blood pressure at home and are trained on the proper techniques, including sitting still, resting their arm on the table, no recent coffee, cigarettes, and similar. They're also taught about salts and other dietary influences on blood pressure, as well as other topics that empower the patient to work in partnership with their provider to manage their hypertension. SMBP is delivered in a variety of ways across the state. For online delivery, the state of Alaska has a contract with a company called Omada. Omada delivers the blood pressure self-measured program completely online through their app, and participants can complete the curriculum during the week at their own pace. They'll then meet with their coach through the app. The coach is specifically trained in blood pressure management. They will also have a chance to chat with other members of their cohort. One thing that Omada does for the state of Alaska is work to clump participants into cohorts of regionally similar participants. The last thing to know about the program is that individuals who join will also receive a free Bluetooth blood pressure cuff in the mail. This peripheral will link directly to the app so that data on both the results and participation can be shared with their coach in real time. Individuals who sign up for the Omada blood pressure program but also qualify for the National Diabetes Prevention Program or the Diabetes Self-Management Education and Support Program can dual enroll in both programs. To enroll in these programs, your patient will need to visit omadahealth.com/Alaska. SMBP programs of all types are delivered across the state. Of all of the risk reduction programs supported by the state, SMBP is the least prescriptive. And because of this, each program is highly adaptable to fit the community needs in which they reside. Some programs are embedded into a clinical setting, some are in community groups like craft nights or libraries, and some are delivered completely by community-based organizations. The list of SMBP programs is constantly changing as more programs are joining on. If you do not see your program on this list, or you do not see a program in your community but would like to start one, please feel free to reach out to the state of Alaska at heart@alaska.gov. Again, in review, in addition to being delivered in person, the SMBP program is delivered through the Omada platform at no cost across the state. When you speak with your patient about the Omada platform, there is one important heads up. The very first page your patient is going to see is an intake form that asks about insurance. Don't let this be a deterrent. The questions about employment and insurance are just to help the state of Alaska make sure that if a patient's employer covers Omada, they will be referred to the employer's page. If their employer does not cover Omada, the state will cover the cost. Either way, there's no cost to the patient. This is just a heads up so that our grants can go farther and reach as many Alaskans as possible. Encourage your patient to click on the drop-down menu or simply click on None if they do not have any coverage. Inclusion criteria to these programs is pretty basic. Patients with hypertension who are over 18 qualify for the SMBP. There is some exclusionary criteria, like folks who've had a recent cardiac event will not qualify for SMBP. However, each program has an enrollment screening form that will assist the candidate in screening into or out of programs as appropriate. We see the most success with referrals into these programs for providers who follow the Ask Advise Connect model or similar models. These models and some team-based care allow clinical teams to work with their patient to actively connect them to the appropriate program. For online programs, simply ask your client to visit omadahealth.com/Alaska. Each of these programs encourages the participant to maintain a strong and collaborative relationship with their provider. Some of the in-person programs, such as the YMCA, will mail you a letter letting you know when your patient achieves certain milestones. The online program, your patient can actually email you their data. They will just need an email address from you, which they can enter into the system during their setup process. It may take some partnership and collaboration with your patient as an equal team member to continue reporting back on their successes and progresses. Team-based approaches can help distribute this work. Health equity and cultural tailoring are important to all of these programs. Access to care and patient empowerment are the key. We recognize that not every person has the same access to care. For some, in-person is the best option. For others, a program they can do at home, like the telephonic-based or web-based program, is the right option. We work hard to create what we call a no wrong door policy. We want to identify access barriers and work with regions and clinics and statewide distance programs to overcome these barriers. Each program works to empower patients to become an equal partner and an owner in their wellness journey. We believe that teaching patients is more powerful and more sustainable than simple medical interventions alone. And these programs all work in collaborative partnerships with the medical system to empower patients to understand their health and create long-lasting lifestyle change. Experiences will differ for each patient depending on which type of program they decide to use. However, in the web-based program, participants are placed into regionally specific groups with other folks of similar geography. This helps to create connection and community and collaboration. Clients in the online program will also meet with their coach in a manner and a time that works best for them. The curriculum can be taken by a person at their own pace throughout the week, and they'll work in collaboration with their health coach to identify dates and times and means of participation that work best around their busy lives. There's many tools available to assist providers in linking their patients with more resources to achieve their wellness goals in the midst of chronic disease. Look for the link in this presentation to see more. To learn more about these programs or any of the other programs supported by the state of Alaska, feel free to reach out to us at heart@alaska.gov or diabetes@alaska.gov. If you're interested in joining our coalition, please feel free to contact us at any of these email addresses on the screen. Thank you very much.